Hello, this is Bill from Mission Veterinary Clinic, and I would like to discuss correspondence within Cornerstone, in particular go home sheets, as well as informational and client sheets. So first I'm going to get started. I am going to use the client, William O'Leary, and I'm going to go over and expand the list and use the patient test 5. I'm going to left click on test 5. I'm going to right click and I'm going to go to correspondence. Now here you can see that I have some favorites saved. I can customize these favorites to every person individually. So if you want your favorites to be different, write them down and let me know and I will change them, or email me and I will change them to whatever you'd like. But in this case, I'm going to go to all correspondence. I'm going to enter in my staff ID and I'm going to go tab, and then I'm going to go to category. Now here you can notice that we have Mission Veterinary Clinic approve, sign, decline, and sign forms. And there we have a whole bunch of forms from our health certificate, anesthesia consent, comprehensive, declined, etc., um, spay neuter consent. All of our consent, decline, anything they typically sign for, have to sign for. Then we have our MVC certificates, our rabies certificate, spay neuter, and vaccine. Then we have our MVC client information sheets. These are general client information sheets on all sorts of conditions. You can just scroll through there, everything from tapeworms to parvo, all kinds of stuff. Emails. These are pre-done email templates I've made on animals that are positive on coccidia, giardia, roundworms, tapeworms, and a general lab results email for patients that have normal email results. But all of these can be used to email the clients regarding lab works. And then finally, go home instructions, which is the reason we're here. Um, so here are some pre-done go home instructions. I think by using this, it will really help create better client communications. So we're going to go through and choose one at random. Let's just choose laceration repair discharge sheet. So I'm going to double click on that.
I'm having trouble hearing you.
So I'm going to come in here. Once again, I want to give it a name the best I can. And the name could just be laceration discharge instructions. Okay, laceration discharge instructions. In here, I can edit this as much as I want. If you can see, like here, it is pre-put in test 5's name, so it knows the name of the pet in multiple places. But as you look through this, the doctor or the technician, they can go through and edit it as they need. They may see do not bathe test for 14 days. They could simply go, boom, I want to change that to 7 days. Monitoring e-collar, they can modify this without it touching the template however they like. Okay, they get to the very bottom and they save it. Okay, I would print it and put a copy on the chart and then save it. I know it is not. Are you sure you want to save? Yes, I want to save it because when the client comes in, I'd like to make them sign for this chart. Okay, so we're going to click OK. We're going to close this. Now, like all correspondence now, that's still tentative. It is not final, which means if we go up here to the daily planner, which is this suitcase in the upper left-hand corner with the red cross, and we click on that, and we go to correspondence under William O'Leary, because William O'Leary made this, that laceration discharge instructions is sitting there. So when it's time to go home, actually at any point in time the doctor could check this, make sure it's what he wants it to say, but when it's time to go home, they will open this in the exam room. They will go to the client signature, click on this. There's no signature capture device set up to this computer. If we were in an exam room, a window would open up for the client to sign, and it would populate the sign here. It would auto finalize and be saved into the client's record. Okay, I'm going to go ahead and auto finalize this and save it. Then now you're handing the client assign a copy. You could actually email the client as well. Give it just a second. Boom, send. So an email is going to show up in William O'Leary's email box in a few minutes with a copy of those go home instructions. Email has been sent. Click OK. And this has been finalized, so we can close that. And at any point in time, if I go to test 5's history, I will see laceration repair discharge instruction tentative. If they had signed it, I would be able to open it up and see the client's signature here. Purpose of this is now and then we get clients that call up and they're upset and they say no one gave them proper instructions. These discharge instructions will provide better medicine for the doctors and for our clients, and it'll help us to have better communication. So when clients call up and say no one explained anything, by having this discharge instruction and a signature on file, we're able to defend our position better and know if the staff are really explaining medication and the go home instructions or if they're not. So it's very important we do this. Same thing, I'm going to go back to test 5 and go to correspondence again, all correspondence. I'm going to enter my staff ID. I'm going to go to client information sheet. We have all these information sheets on different products, on different diseases, conditions, whatever. Parvofax is a very common one. We can print this out. At the end, it'll ask for the client's signature, so we can make the client sign for it, whether they use treatment or not. But then we know positively on a regular basis. I'll talk to a client who has a hospitalized patient and they act like no one explained anything to them about parvo, and I don't know if it was explained to them or not. But by having a signed form in here, then we know positively that parvo was explained properly because they've got a written sheet to go home. And once again, as the doctor is reading this, if he doesn't like something, he can edit it per that individual patient. If the doctor wants the template edited, he can let me know and I will go in and edit that template. So if I go up here and I go final and click OK, it's telling me it has not been signed. Do you want to save the document? Yes, I do. Even though it hasn't been signed, I want to save it. And now in the summary, under history, I have Parvofax final, and there it is. Okay, so just a little information on correspondence and things we can do to have signed to have better communication with our clients.